Living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
It started with a phone call and ended as a case of stolen identity. Millions of Americans are victims of phone-based healthcare scams every year. And as more people gain access to Medicare programs, more criminals are targeting those with insurance to steal their information and identity. Learn how you can avoid becoming a victim of fraud. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm Janet Whitmoyer, your host. Stay tuned. Welcome back to Healthy Living for Life. Our first guest today is Kimmy Everman, the Director of Montana State Health Insurance Assistance Program, commonly known as SHIP.
That's right.
That was a mouthful.
Yeah.
Welcome and thanks for being with us, Kimmy.
Absolutely, love to be here.
Okay, so the first thing I want to talk about is Medicare cards.
Okay.
It's my understanding that all Medicare members are getting new cards. Is that true?
It is, and it's so exciting. We've wanted this for such a long time because our previous incarnation of cards had a person's social security number on it. And so what is going to happen, and it's already started happening as of April 2018, waves of new cards are going out to 58 million beneficiaries, and they have randomly selected number, letter types of claim numbers on their cards now.
Oh, that's interesting. So can you tell us, and so for people that are going to be getting in the cards, what are they going to look like?
Well, they're going to be red, white, and blue,
Okay.
much like the ones they have now. And I think one thing to really keep in mind is this is a huge, huge project, and so they have a year to get those out in waves. So it's going to be going out from April 2018 through April 2019. And if you get anything sort of from the CMS logo with the dove that lots of people on Medicare have seen before, that might very well be your new card.
Okay. So when people get their new cards, what should they do with their old cards?
Well, they want to destroy their old card immediately. And however you do that, put it through the shredder or whatever so that nobody else can get their hands on it. But do not destroy the card until you get your new one. And we can talk about this in a minute, but there's some wiggle room about that new card getting to you.
So pretty much treat it like an old credit card, maybe?
Yes,
Okay.
absolutely.
All
Yeah,
right.
don't
Perfect.
keep it or put it in your drawer and hope that it doesn't get stolen or something.
All right, perfect. So if someone has regular Medicare and then also a Medicare Advantage plan, will they still be getting the new Medicare card?
Yes, they
Okay.
will. Everybody that's a Medicare beneficiary is a Medicare beneficiary, no matter how they receive their medical care. And the Medicare Advantage plan is just a different way of receiving it, but they're still Medicare beneficiaries. But they should also remember to not get rid of that Medicare Advantage card.
Okay.
Because that's a different thing, and they're going to need that in addition to their other cards.
So in some instances, people will actually have two,
Right.
quote, Medicare cards.
Exactly.
Okay.
Exactly.
So the next question I wanted to ask is, what is the address, or how will people be getting the cards? Where will they be sent to?
Well, what we want people to know is that there's one thing that the Social Security Administration has to do with this huge project, and that is they are using those addresses of the Medicare beneficiaries to get all those cards sent out. So it's really, really imperative that your address with Social Security is correct. And in Montana, we sometimes have problems. It's the mail person knows it's the mailbox down the road, but if you have an actual, even a P.O. box, that's what needs to be correct with Social Security.
Okay. And I know that there's problems with scammers using telephone, calling people and saying that they need to talk to them about their new Medicare card. Is there ever an instance where Medicare would do that?
No, Janet, the only time that I can even imagine that happening is if the person or the beneficiary reached out to Medicare first.
Okay.
They are not going to initiate a call to you. They will send you something in the mail. And even, you know, the scammers anymore, even saying, give me your phone number and I'll call back doesn't work, because they have technology now that can make that number you call back whatever they want it to be. My husband went through that with the IRS scam. And so it's very important. If you get a call out of the blue, don't say a word, hang up. There's nobody who's going to call you from Medicare unless they've sent, well, no, not unless. They're going to send you mail.
Okay. So if somebody doesn't receive a card in the mail, who should they contact?
Well, first let's talk about how these cards are going out.
Okay.
Of course, with 58 million beneficiaries, that's a lot of cards. And so they've been going out in waves, and in Montana, our waves they've begun. And they're not identified to us as to when this part of the alphabet is getting what. So it could be all the way up till April 2019 before you get your new card. I don't expect that, but that's the time frame that the folks at the Centers for Medicare and Medicaid Services are giving us. And you just keep using your old card until your new one comes. Now, if you decide that you've waited too long, maybe next fall here, call your SHIP counselor.
Okay.
And I bet we can put the number up.
Absolutely.
And also you can call 1-800-MEDICARE.
Okay. So the same thing if somebody does get their card and, excuse me, the information is incorrect, could they also contact you and Medicare as well?
I suggest that they call their SHIP counselor
Okay.
first, their local SHIP counselor, because Medicare, 1-800-MEDICARE can be a frustrating experience at times. Just because they're very menu driven, you have to press lots of numbers, and it can be difficult for some folks. So getting with their local SHIP counselor, that's the way that I would handle it.
Okay. I have one last question really quickly. We're
Okay.
down to 30 seconds.
Okay.
Are there going to be any changes to the new card as far as information benefits?
Nope, only
Okay.
only the number.
Okay, perfect. We'll pause here for a short break and we'll talk about Medicare fraud with Kimmy when we return. Stay tuned.